Boonesboro, Maryland. Margarettsville was founded in 1972 by George and William Boone, cousins of the famous Daniel Boone. In 1823, prosperity and growth came to the area with the construction of the national road that connected the big cities in the east to the small towns in the west. The population continued to grow, and so did the desire to self-govern. The town became incorporated in 1831. They changed their name to Boonesboro and held their first election. A few years later, the Battle of South Mountain began. It was the first battle of the Civil War held on northern soil. Boonesboro is located in the foothills of central Maryland, between Hagerstown and Frederick, both mid-sized metropolitan areas, and an hour's drive to Washington, D.C. and Baltimore, Maryland, both larger metropolitan areas, making Boonesboro an ideal location for commuting to work. The approximate land area for Boonesboro is 1.52 square miles. Boonesboro is a small town with a population of 3,336 residents, making the population density 2,194 residents per square mile. There are 3 preschools in the area. The state of Maryland does not offer programs like voluntary pre-kindergarten, so families must have the financial ability to pay weekly or be eligible for child care assistance through the state. Half-day programs can run anywhere from $75 to $100 a week, making it financially unobtainable for some families in the area. There is 1 public elementary school, 1 public middle school, and 1 public high school located in the education complex in the center of Boonesboro. There are no private schools or colleges in Boonesboro. The closest are located in Frederick or Hagerstown. The Boonesboro Public Library is centrally located right off the square. They are open Monday through Friday and offer infant story time, toddler time, kids programs, teens program, adult programs, and that offer assistance with finding jobs, selecting healthcare insurance, and basic computer. The town has 1 grocery store and 1 bargain retailer, both located on the outskirts of town, approximately 5 miles from the square. The grocery store is open daily, and in addition to general grocery items, the store has a small deli and the only pharmacy in town. The town offers a limited selection of places to eat. There's a Subway restaurant, a pizza place, an ice cream store, and an organic restaurant. Boonesboro brings in Civil War enthusiasts and the romantics at heart. The Boonesboro Inn is located by America's best-selling author Nora Roberts. Each room is themed after a famous love story. The rooms here are approximately $225 to $305 per night. This is the only lodging available in the area without having to travel to Hagerstown, Frederick, or Shepherdstown. The Boonesboro History Museum has Civil War relics found in the area on display, and the Crystal Grottos is one of the largest caves in Maryland and has thousands of beautiful formations. Boonesboro offers a variety of housing. There's a combination of old row homes and single-family homes converted into apartments, intermingled with businesses through downtown Boonesboro. There are new homes being built on the outskirts of Boonesboro, and of course the old farm homes. Low-income housing is available in 2 small developments, and in addition to these units, Washington County issued 578 Section 8 vouchers to assist Boonesboro families with their housing needs. Angelina Bushy states that rural areas tend to have a higher population of white people than urban areas, and this holds true for Boonesboro as 95% of the population is white. She also states that there is a higher percentage of those under the age of 18 or over the age of 65, and that 1/4 of these live at or below the poverty level. Boonesboro does not follow this trend, and this may be due to the population shift, where the population is shifting from urban to rural areas that lie just right on the edge. Boonesboro has experienced a population explosion with an increase of 553 residents in 10 years. This kind of population growth strains a community's facilities and services. The elementary school is overcrowded now and is expected to reach a 200% capacity by 2017. This not only impacts the child's learning, but increases a child's risk of picking up an acute respiratory infection or other communicable disease. This impacts are public safety. The International Association of Chiefs of Police recommend 2.2 officers per 1,000 residents. Boonesboro currently has 4 full-time police officers and utilizes the services of the Maryland State Police and the Washington County Sheriff's Office to comply with this recommendation. It strains our fire service. There was a 36% increase in the number of calls for the Boonesboro Volunteer Fire Department in a 2-year period. The National Protection Agency recommends an area like Boonesboro have 10 personnel available to respond to calls. Currently, the town has 2 paid positions and relies on volunteers to fill this void. It strains our water and sewer facilities. In 2009, the existing permits allowed for 845 more housing units. This will not be adequate to ensure clean drinking water for the projected growth. The state of Maryland recommends 30 acres of recreational area per 1,000 residents. Currently, the town of Boonesboro provides 32 acres per 1,000 residents, but has plans to annex property nearby for this population growth. There is no hospital or urgent care facility located in town. The closest hospital is 15 minutes away and is a level 3 trauma center open 24 hours a day. They accept most insurances, including Medicaid and Medicare, and may be the only healthcare option for a Boonesboro resident, as they are available, accessible, and affordable. The South Mountain Family Practice is the only physician's office in town. They do not accept medical assistance and offer appointments Monday through Thursday. This healthcare option is accessible in terms of location, but not to the resident with medical assistance. The Washington County Health Department is located in downtown Hagerstown, approximately 25 minutes from Boonesboro. They are open Monday through Friday and offer care on a sliding scale. This healthcare option is affordable and available, but not accessible to those living in Boonesboro with limited transportation. I believe that these 3 Healthy People 2020 goals are applicable to the residents of Boonesboro. AHS 6.1, to reduce the number of persons unable to obtain or delay obtaining necessary medical care. Studies show that those over the 18 that live in rural communities are less likely to take preventative health measures, including blood pressure assessments, pap smears, and colorectal screenings. NWS-9, to reduce obesity among adults over age 20. 28.8% of the adults in this area are considered obese compared to the state rate of 26.6. And HDS 5.1, to reduce the proportion of adults with hypertension. Heart disease is the #1 killer in Maryland in 2013, and hypertension is a leading cause of heart disease. Boonesboro does have an environmental issue. They have a high air particulate matter, which could be due to the increased combustion from gasoline and diesel vehicles, the use of fireplace and wood stoves, and dust stirred up by vehicles on unpaved roads. This fine particulate matter in the air does pose health risks, including exacerbation of asthma and bronchitis, and an increased risk of lung cancer. A person is more likely to be affected when doing strenuous work outdoors when the particulate matter is high. Boonesboro does have an elected mayor, assistant mayor, and 5 council members, each serving a term of 4 years. The council members have the power to pass ordinances that they deem necessary in accordance with the Constitution and the laws of Maryland. They hold meetings the first Monday of every month to hear community concerns, receive updates from various commission chairs, and discuss new business. These meeting minutes are available on the town's website. Town economics. It's really no surprise that 85% of Boonesboro's revenue comes from some sort of tax, whether it be a property tax or a shared state tax. The tax is used by municipalities like Boonesboro to provide law enforcement, emergency medical services, and support town infrastructure. Boonesboro's biggest expense right now is the police department, non-departmental expenses, and highways and streets. This is a list of the community nursing diagnoses that I have prioritized based on the number of residents that I believe will be affected if these problems are left unresolved. Risk for ineffective health maintenance among those with insufficient family resources related to obtaining accessible health care. These are the people with medical assistance and limited access to transportation. The family physician group in town will not take them because they have medical assistance and they must travel to Frederick and Hagerstown to receive services. There is no bus service available in Boonesboro, and cab service is very expensive. Risk of deficient community health among the growing population related to insufficient healthcare services. This is the population growth we were talking about. How is one physician group expected to handle such a rapidly growing population? Risk of infection among Boonesboro Elementary School students related to overcrowding. As the population continues to grow, the risk of infection continues to grow. Risk of imbalanced nutrition, more than body requirements among Boonesboro residents related to a long daily commute and limited access to a grocery store. Research shows that the longer commute times can contribute to obesity, and the average daily commute for a resident of Boonesboro is 39.4 minutes. The location of the grocery store also can contribute to obesity, being that this is a 10 to 15 minute drive if you live in one of the older established communities. Risk of knowledge deficit among residents of Boonesboro related to immunizations. Washington County has one of the lowest immunization rates in the state of Maryland, and with the recent measles outbreak in the country, the residents of Boonesboro should check with their physicians to see if they need to receive that second vaccine to protect themselves and their family and their community. Risk of altered gas exchange among those residents with asthma or respiratory diseases related to high particulate matter in the air. Particulate matter in the air is higher than average, which can exacerbate asthma, chronic bronchitis, and other respiratory conditions. It's hard to deny the benefits of vaccination, and diseases like polio and diphtheria have almost been eradicated in the United States. They prevent dangerous and sometimes deadly diseases from making us sick. So it's so hard for me to understand why immunization rates for children entering kindergarten in Washington County was only 93.3% in 2011. Let's compare this globally. 84% of infants worldwide were vaccinated with diphtheria, tetanus, and pertussis. 44% of infants were vaccinated with the rubella vaccine. Reasons for these low vaccination rates include non-existent or poorly managed immunization programs, a lack of accessibility, and lack of funding. We don't have these problems in the United States. Washington County currently screens all vaccination records for new students and incoming kindergartners to ensure that they've received their DTaP, their MMR, their polio, their hepatitis B, and their varicella. Parents do have the right to claim a medical and a religious exemption. The state of Maryland provides Vaccine for Children's program, offering free vaccine to children that are on Medicaid, uninsured, underinsured, Alaskan Native, or Native American. Immunizations such as the flu vaccine are being offered one time a year in the school with parental permission. As a community health nurse, I feel it's my responsibility to educate parents on the benefits of vaccinations and help disprove any wrong information that they may have received. I'd also help point them in the direction to resources that may help with the cost of these vaccinations. Some parents, they're not against vaccinations, but they've overlooked it, and simply bringing it to their attention will address the issue.